As health systems around the world concentrate on fighting a pandemic, it can be hard to remember that other ailments exist. But at a time like this, those who are already sick are among the most vulnerable.
It's a well-recognised fact that in any emergency situation, any pandemic situation, those who have other illnesses also do worse than they would otherwise because of the movement of resource towards the pandemic.
There are patients who are diabetic, hypertensive, there are kidney patients who need their medication, who need their regular dialysis and all that. So whatever requires a must visit to the hospital, they should come.
Indigenous populations, as I mentioned before, face high rates of food insecurity, type 2 diabetes, and are affected by endemic diseases such as TB and malaria, which make them more likely to suffer the burden of this pandemic.
In the era of the coronavirus, how can we ensure that everyone is taken care of? For months, it has dominated our news broadcasts, shaped our fears, and altered our behaviour. But at what cost? As the world's resources and attention are diverted to COVID-19, other diseases are being cast into the shadows. It's a phenomenon that can be seen all over the world, including in the Belgian capital, Brussels.
Laure van Bol is happy to be finally treating patients again. The eye specialist at the Erasmus Hospital in Brussels has only been seeing 2 or 3 people a day under the corona lockdown, a drop of almost 90%.
Even the surgical medical retina team, they've seen a drop in the surgical problems, such as retinal detachment, for example. Nearly no cases in April, which is actually not possible, so people just don't show.
People are scared of contracting the virus in hospital, like Pascale Leflon. She could lose her eyesight if she doesn't get regular treatment. It took her all the courage she could muster to come here today.
Moi, personnellement, j'ai très peur de l'attraper.
I'm very afraid of catching the virus. Apart from my eye problems, I also have respiratory issues. So yes, I'm afraid.
Donc j'ai vraiment peur de l'attraper.
Doctors say they've never experienced anything like it. Belgium was among the countries worst affected by the pandemic, but infection numbers are now in decline. This hospital has only 30 corona patients, down from 120 at the height of the crisis, and they are strictly segregated. Since early May, Belgian hospitals have been allowed to offer a limited number of non-urgent consultations, but people are not taking them up on the offer. The consequences are dire, not only for patients, but for the entire health sector, says the Director General of Saint-Pierre Hospital.
First and foremost, this crisis has really put the hospitals, all the hospitals in the country, under the water, financially speaking. So we have lost dozens of million euros. Just because while we were taking care of COVID patients, we had to stop everything else. And everything else is what brings money to us.
The director expects the hospital to be 40 to 50 million euros in the red this year. He wants the government to step in and compensate hospitals. Without state help, he says, his hospital will have to cut all investments to stay afloat. That would mean not maintaining and modernizing equipment. Scores of medics turned their backs on Belgium's Prime Minister during her recent visit to the hospital. One of them was Julien Versteegh. He says staff have been shouldering the enormous burden of an already weakened system.
They have to form and to educate new nurses, So we, in all sectors of the hospital, we have a lack of employees. So everybody is under pressure. Everybody is under stress.
And money isn't the only problem. Restrictions in the ongoing emergency plan leave Saint-Pierre Hospital operating at just 30% capacity.
We would like the government to relax some of the rules. I completely understand the worry about the second wave and the fact that we still need to be ready, and we will. but we also need to take care of all the non-COVID patients who are also suffering from, serious diseases for many of them, and diseases that could have consequences as bad or even, worse than the COVID.
Particularly if these patients all come at once. Laure van Bol is worried that a wave of people desperately seeking treatment could be on the way. To avoid that, she's encouraging patients to come now. She says that the hospitals are safe. And what's more, waiting times for an appointment are shorter than ever.
To find out more about the effect the coronavirus has had on the treatment of other diseases, I'm joined now by Dr. Masoud Dara. He's the coordinator of the Communicable Diseases Programme at the World Health Organization's Regional Office for Europe. Dr. Dara, welcome to the programme. You've warned that the focus on COVID-19 comes particularly at the expense of treating other infectious diseases, especially tuberculosis and HIV. Tell me about what hospitals are experiencing right now.
There are several challenges that we have here, particularly on the timely detection of the infectious diseases. As to do lockdowns, the services are not provided, people are not coming for diagnosis, but also we are very much concerned in terms of making sure people are put on the right treatment during the COVID-19.
Now, your work focuses on Europe specifically. What are the biggest issues here?
Obviously, the challenge is that we should make sure that all the services are provided and the diseases that are extremely important, particularly infectious diseases, are being taken care of. And we call them essential health services. Very important, as you know, particularly during the lockdowns. A recent study showed that only with 3 months of the lockdown, we may have almost 6 million more people getting infected with tuberculosis. As you know, 1 out of every 4 persons in the world is already infected with tuberculosis. And we may develop the disease in any time. So it's very important to have timely diagnosis. Now, the challenge is that if the diagnosis services are not available, or if they are diverted to focus on COVID-19, these people will not be detected on time. And as a result, a study which led by the Stop TB Partnership showed that 1.4 million more people will die only due to these 3 months of the lockdown globally from now till 2025. So that's a very important element to take into account to make sure that services are provided. On HIV, as you know, the challenge is that we should make sure also the early detection of the people, but also they're put on treatment, because once people are put on treatment, they will not be infecting other people and they will have a healthy lives. And that's a challenge that we have to make sure that services is essentially provided for people.
Okay, so some huge challenges here. Now, this is, of course, a global problem. So outside of Europe, what areas of the world are you most worried about?
I think we should be worried about the whole world. Infectious diseases don't have any border. But to be more specific, where is basically we have the health system are not as strong. And where is the poverty, we may see more infectious diseases. Recent World Bank publications actually estimate that due to COVID-19 and economic loss, we may have from 70 to more than 100 million people going to the extreme poverty. And of course, where you have poverty, you also have infectious diseases as well. So extremely important to be very conscious that we need to invest more in infectious diseases as well as non-infectious diseases, but also healthy life of the people across the planet.
Dr. Masoud Dara, thank you so much for your time. Time now to answer your questions about COVID-19. Over to our science correspondent, Derek Williams.
Is there any proof that chloroquine or hydroxychloroquine benefit patients?
At the beginning of this pandemic, anecdotal evidence about patients who had supposedly been cured with the help of a chloroquine derivative touched off a race to find out if it can help against COVID-19, setting in motion what one colleague in a recent article called a fog of alleged misconduct, hope, hype and politicization. It's really a beautiful description. I really wish I'd come up with it. After bouncing back and forth on the topic, however, major studies, including the largest one, are now coming to some negative conclusions about the anti-malarial drugs. Its researchers ended it early because convincing preliminary results strongly indicated hydroxychloroquine has no effect on mortality. Other studies looking at using the compound as a prophylactic to prevent people from catching COVID-19 were also discouraging. The WHO is expected to make a recommendation on the issue sometime this week.
Is it true that people who are asymptomatic are unlikely to infect others?
We know that some of the people who contract COVID-19 never show symptoms, though we still don't know how many. It could be a lot. So it's not surprising that a comment made by a WHO representative at a press conference last week about asymptomatic patients being very rare transmitters, that it caused an uproar. That's because the statement seemed to imply that symptomless people don't really pose a danger to others. If that were true, maybe anyone not showing symptoms could, for example, stop wearing a mask. The problem is that it's impossible to know whether, if you have COVID-19, you might actually only be pre-symptomatic instead of asymptomatic and start showing symptoms tomorrow. And pre-symptomatic people are likely to be highly contagious. So even if it turns out that truly asymptomatic people are not very infectious, which still hasn't been proven, it shouldn't affect anyone's behavior, because distinguishing between asymptomatic and pre-symptomatic people is at this stage impossible.
How will COVID-19 affect populations in terms of deaths and birth rates?
COVID-19 is currently killing between 3,000 and 6,000 people a day worldwide. That's around a tenth of those who, before the pandemic, died every day from heart disease. So although the number is high, it would have to get much higher still to have a big demographic impact. When it comes to birth rates, you see a much more checkered pattern. In many developed countries where birth rates were already low, they appear to be falling further. But many experts think that effect will be canceled out on a global scale by a lot more pregnancies in countries where access to contraception has been radically altered by the pandemic.